In Philippians 1 verse 6, it says, "For I'm confident of this, that the one who began a good work in you will continue to complete it until the day of Christ Jesus." Just as the stretch exercise helps to loosen and mobilize the hip joints, may our faith in Jesus Christ loosen and free us from the tight grip of sin and doubt, mobilizing us to move forward in our walk with God, confident in his promise to complete the good work he has so faithfully started in our lives. I'm Roman Hunter. Welcome. Today we're going to be talking about the quadruped rockback hip posterior capsule mobilization stretch or mobilization exercise. A self-mobilizing exercise, one of the mobilizations with movement type of exercise, is a wonderful technique to help loosen the hip area, provide more range of motion, more mobility, especially for persons who have issues with hip flexion. It really helps to improve hip flexion and also helps to alleviate the pain that is accompanied with or that comes with femoral acetabular impingement. Right, so it's a wonderful rehabilitative exercise for persons who have hip impingement, okay? And it really helps with hip flexion. So the starting position of this exercise, right now I have here a large resistance loop. This one is a moderate resistance. You can use a high resistance depending on the amount of pull that you want from this stretch. Now I have it anchored, I have one portion of it anchored to something stable, and I have it close to my groin area. So when you have the loop on, you want to make sure that it is close to the groin area as much as possible. If it is that it's against the skin, you can use a towel, you can use a cloth, something to cushion right there to put between your skin and the rubber band. Okay, so I have it right here close to my groin area, right up to the groin, because it is the posterior capsule of the hip that you're trying to mobilize. So you want to make sure it's as close to the groin as possible. And you're on the knees and go on the hands. You want to make sure that the shoulders are above the hands. Hands are shoulder width apart. Like that, shoulder width apart. Knees are shoulder width apart as well. Hips are bent at about 90 degrees. Hip flexion. All right. Now, depending on how far you move from the band, that will determine how much tension and pull you'll be getting from the band. So if you really want a lot of tension, you move forward a little bit. If it is that you can't tolerate that much, then back off a little bit. All right. Now, what you'll be doing is pretty much rocking your body back. You don't want to go all the way back down to the heels like this because you don't want flexion of the back, right? You want to avoid that curvature of the spine. So you're trying to keep your body, you're trying to keep the spine in a neutral position. Make sure you brace your core so that the back doesn't sag as well. You don't want to sag the back. You want to keep it nice and neutral. And all you're doing is just rocking back a little bit. Just to the point so as to avoid bending of the lumbar spine. You don't want to be flexing the lumbar spine, so you're just rocking back a little bit. I've seen people go all the way down like this. You don't want to include the spine there. All you're doing is mobilizing the posterior hip capsule, right? So all that's required is just a gentle rock back. And you're going to be holding it for about 3 to 5 seconds, and then you back out. Back to starting position, and then you rock back again, back into that position, 3 to 5 seconds, and then you back out. So whether your feet are on the toes like this or flat like that, it doesn't really matter at this point. Whichever one is more comfortable for you. But just try not to rock all the way back to the heels. You're not going to the heels, you're just stopping. Just so as to maintain that neutral alignment of the spine. And then once you're more comfortable, you can move forward a little bit more to get a little bit more stretch, a little bit more pull. And then continue again. Rock back. The quadruped rock back hip posterior capsule mobilization stretch. It's a wonderful exercise to add to your program. Again, if you have any predisposing hip problems and you think you would benefit from this exercise, but you're not sure just yet, it's wise and advisable to seek medical advice and counsel from a physiotherapist first before performing this exercise. Otherwise, from that, it's a wonderful exercise to increase hip flexion, to reduce the pain that you get from femoral acetabular impingement or hip impingement, and to just help with overall mobility and range of motion of the hip joint. Remember to like and subscribe to my YouTube channel. I'm Roman Hunter. Have a wonderful day. Blessings.